Welcome to the Maine Academy of Nutrition and Dietetics COVID Conversations video series. In this series, we will speak with dietitians around the state of Maine who practice in a variety of settings, focusing the conversation on how the COVID-19 pandemic has both positively and negatively impacted their work. Hey Kay,
Hello, Leslie. How are you today?
good. Thanks for joining me this afternoon. I know a lot about you, but could you tell us a little bit about yourself for our viewers to kind of get a clue as to who you are, where you work, and what field of dietetics you work in?
I would love to do that. So, my name is Kay Mullen, and I'm a registered dietitian and certified diabetes care and education specialist. I've been practicing in the field of dietetics for way more years than I like to admit, about 30 years, and I've been a diabetes specialist for about 20. So, my current role is that I work for Maine Medical Center's pediatric specialty clinics in their outpatient clinic, which is kind of an extension of Barbara Bush Children's Hospital. And I support the pediatric gastroenterology, nephrology, and pulmonary divisions with some pretty medically compromised and challenging kids, as well as, just children or families that I work with for other health and wellness reasons. But we kind of see some of the more complicated children from all over the state who have feeding issues.
Wow, that's much more intense than I could ever imagine. So our interviews are a lot about how the COVID pandemic has impacted your work as a dietitian. So, in dealing with the sickest of the sick kids in the state of Maine, how has your work as a dietitian been impacted?
So, back on Friday the 13th, we all received notification that we would be transitioning to home. And we all had to kind of put a pause button and say, oh my gosh, how are we going to take care of these medically fragile children? Fortunately, as a dietitian, we have always had the ability to do telemedicine and either via telephone or with video conferencing. And so our organization quickly transitioned to doing telemedicine for all of our families. I have to tell you, it's probably been a godsend for so many people. The burden of care for some of these more medically complex children is very, very high. So when you get into traveling for visits and trying to do multiple visits in one day, and you're talking about coordinating family help because the families need help with transportation, they need nursing care. There's so many levels to getting some of our children down to our clinic to be seen, that being able to do some of the visits telemedicine via telemedicine has been, such an amazing relief for these families.
That's a really good point. I think we often forget how chaotic someone's life was prior to the pandemic, and then all of these stressors are just, exponentially increased. Now you have this kid that is immunocompromised, getting in a transportation van, having to travel 3 hours. So I can imagine the relief some parents must have in just being able to pull up their phone and talk with you face to face.
Absolutely. And as a dietitian on the other end, it's been incredibly helpful for me to be in the client's home, potentially, for some of my infants that I work with, watching the parent mix the formula to make sure that the formula is mixed correctly, to see the setup for a child who's being enterally fed, and to have the parents complaining about reflux and seeing them lying completely flat and being able to instruct the parent on how to wedge a bed. Some of these simple tasks that you may or may not be able to address in an office, we're actually seeing and being able to intervene in relevant time and a relevant place for some of these families. It's been really incredible.
That you're giving me goosebumps. So besides I didn't even think about the fact that you could just sit right there while they make the formula or prepare some sort of food. So besides all that, can you think of any other benefits that have happened or that you've seen because of our push
Mhm.
into telemedicine?
Yes. I think one of the most important pieces for me is the ability for some of these families with very complex schedules to be able to maintain visits and appointments. You can follow up with people more consistently. They're not canceling because of transportation issues or cost. And honestly, as a cost to our state, there's probably a reduction because many of these families required public assistance to either be able to transport their wheelchair child in a specialty car seat or a wheelchair. They required nursing care to get there, or they were being reimbursed for mileage through some of the state programs. So being able to see some of these people within their home not only had a benefit for the child staying safe, in a healthier environment, without exposure to germs, colds, flus, and of course COVID, but it also decreased a cost burden for both families and our state.
That just makes me think like in order for some of those families to get to you, they would likely have to take the full day off from
Absolutely.
work if they're working. And so that right there saves the family income loss, right? So we're not only saving the state money, we're also saving the family money um, by being able to take a couple of hours rather than a full day. That's that's just awesome. Um, the other
And
thing that, yeah,
oops,
go
I'm
ahead.
sorry. I just wanted to speak to that. And, we've had several families because some of these children have in home nursing care. And so the parents may be at work. So the nurses are with the child at home logged into Zoom. The parents are able to work but take a lunchtime or a break logged into Zoom and have their medical appointments with the medical system. They get to see their child, they get to see how the nurse is taking care of their child, they get to interact with us all from where they're working, or and again, not having lost time from work. It's been a huge benefit for so many families.
So before we jumped on the recording, I you said something that kind of resonated with me. Um, that and let's see if I can remember what I was thinking. It will come to me. And just the other thing is, as I'm looking outside my windows, we have a ton of snow right now, and so not only are you likely probably getting better, less cancellations, people aren't having to travel in the snow or cancel because of snow.
Absolutely. We have had many families who've been able to keep appointments that they would not have been able to keep appointments before. And, working in a specialty clinic, sometimes our wait time can be very long, because I'm actually the only dietitian who supports those particular services. So, my schedule is quite full. And if they miss an appointment, it may be 8 to 12 weeks before they can actually get a follow up appointment with me. And so, not having to miss an appointment because of snow or a medical condition and being able to do it from home has been, again, another great relief for many families.
I remember what I wanted to say. So before the call, you said that many of your pulmonary kiddos actually spent less time in the hospital this winter. Can you speak a little bit more to that?
I would be happy to. So I'm sure it's a combination of many different things, but some of the children that we end up following long term are babies who were born prematurely. Like we follow some babies who are 3 and 4 and 5 years old now, but were born at 24, 25, 26 weeks. And so they have a increased pulmonary risk. And many times during the winter, they end up with some kind of a flu or virus, in Barbara Bush Hospital because of some kind of a respiratory illness for multiple days. And I've had probably 7 or 8 families say, this is the healthiest my child has ever been. We're not going into doctor's offices. We're kind of staying at home. We're masking. We're more conscious about washing our hands. This is really going to change how we handle appointments in the winter moving forward. So I think for those families in particular, offering telemedicine in the future will only help these kids to stay healthier over time.
Yeah, especially those important years, right? Like under 10 years old, they're building their immune systems, and it's just so fascinating that we, got launched in this pandemic, and we see a lot of negative things that have come from this pandemic, but highlighting the fact that kids that used to be so sick are now staying healthier, is really wonderful. Thank you for sharing that story with me.
Absolutely.
Is there anything else that you would like to share with our viewers about your work as a dietitian, with or without compared to the pandemic?
I think the biggest change in our field is the recognition that medical nutrition therapy matters and that we make a big difference in managing people with diabetes, heart disease, prevention of obesity. And I think the more access people have to people like you, Leslie, in private practice, me working for Barbara Bush Children's Hospital and my pediatric specialty clinic, the more we can intervene with families and help them with healthy nutrition choices and move forward, the better society is and the healthier these kids and families are.
You've hit the nail on the head. And I think, just to follow up with that, and the amount of reduced costs that will eventually happen because we've been able to reach these people before their conditions get too dire. Um, so thank you so much, Kay, for sharing all these stories. And like I said, so much positivity has come out of your experience. So while we're not grateful for the pandemic, we also can acknowledge, the good that has come out of it. So thank you so much.
Thank you, Leslie. It's been a pleasure. And I agree with you completely. We always have to look for the bright side of things. And there are definitely some bright sides to all of this. So thanks so much.
Thank you for watching this video. For more information on the Maine Academy of Nutrition and Dietetics, please visit our website or check us out on social media. For more information regarding the Maine Academy's public policy efforts, please feel free to reach out to our volunteers listed on the slide.